Aaron, as an independent community health system, we know and recognize that we can't necessarily provide service lines for everybody. Can you explain a little bit more detail? And you talked about it recently in one of these questions, that we have the opportunity through this partnership to really expand and enhance our service line offerings. Can you kind of go into details in terms of what this partnership opportunity would allow us to do on the service line front?
Sure. It's a complicated question, but an important one. And really, service lines, I talked about our key strategic initiatives earlier. Service line enhancement is one of our key strategic initiatives. And again, the board and the management team looked at every partnership through the lens of the strategic objectives that we have as an organization. An enhancement of our service lines, not just maintenance and keeping them the same way that they are, but enhancement of them was one of the key objectives. And so I would say we have the opportunity to enhance those service lines in multiple ways. One is through capital infusion and through monetary infusion to recruit and retain additional physicians, to provide providers to provide that access. I think we've had a lot of great success over the last year in enhancing our oncology services, enhancing OBGYN services and primary care access, but we want to do more for the community. There are many subspecialties where folks in South County, in the southern part of Rhode Island, and really now starting as Westerly continues to pull out, Yale continues to pull out its services in Westerly, there is an increasing void of subspecialty access and primary care access in the Westerly market. So how do we continue to, as the major health system provider for Southern Rhode Island, continue to enhance those services? And I would say it would come in as I mentioned earlier, building additional provider access, filling in subspecialty gaps where we don't have subspecialists right now. Neurology is a perfect example. We've had a great neurologist in our community for many, many years, Dr. Peter Bellafiore. He is retired from ambulatory practice. He still maintains call coverage for our hospital, but right now, folks that need a neurologist can't find a neurologist to access in Southern Rhode Island. So how do we enhance those service line gaps that we have by recruiting and retaining through this partnership, through that infusion of additional resources? The other is through our potential partner from a health system perspective. And so there's a lot that you can do today through telemedicine, through video conferencing, through second opinions, through the sharing in the buildup of a clinical database that each system uses to really ensure that you're providing the most contemporary treatment and the best outcomes, as it were, for treatments that change every day. Even simple things like diabetic neuropathy, even simple things like just plain old diabetes. This platform that we would have access to as a part of this partnership would allow patients in Rhode Island to have access to a database that's now has 20 million patient encounters in it and is used by that top 10 health system to be what I would label as a co-pilot. So, AI can be scary for a lot of folks, and there's always the question of, is the robot or the computer going to replace the physician or the provider? And we don't see it that way, nor does this potential partner that we have. What we see artificial intelligence doing is becoming a co-pilot for the pilot in the provider or the physician that's taking care of you, but is analyzing millions and millions of data points and keeping up with all of those themes and trends and advances so that the clinician can help evaluate and use what AI is helping to bring forward in better diagnosing and better treating these kinds of issues, whether they be super complex or the stuff that our providers see on a day-to-day basis. So really those are the ways that we see this partnership enhancing that care over time.